to show a little bit of how patient information exchange can integrate for the benefit of the providers, the patients, and with other applications. What you're seeing now is a census list that a provider might look at when they're logging into the application of patient information exchange. They'll have the census that is their preferred census. They'll be able to get to it very quickly, limiting the number of clicks and navigation. So they're actually getting into viewing multiple pieces of patient information coming from multiple sources. The opportunity will exist for them to actually complete chart deficiencies from this one patient information exchange. You'll see a screen that provides an integration with electronic medical record where they would complete their chart deficiencies. So patient information exchange will actually navigate them into that product, log them into that product, and then allow them to complete those deficiencies from this one location, eliminating the need to log into an EMR and a view of their patient information. With their census list, they're going to be able to select patients to view. They'll have the opportunity to reorder, resort. You're going to notice that there's information from vital signs that can be presented from the bedside charting system, in addition to information from the ADT system. Additionally, the physicians can customize how this works for them. So it's very attuned to their purposes in their workflow. While we're providing these integration options from these various systems, another important element that needs to be remembered are the integration with those providers' office staff. They need to bill for physicians when they see patients at the hospital. So you have a consult that was ordered for a cardiologist while the patient is on site in a facility. However, their office staff never have the opportunity to see that patient. They do, however, have to bill for that patient. This typically includes many calls and faxes and getting information from the hospital to the billing departments for the providers so that billing can happen effectively. A patient information exchange provides that information for billing, their insurance information, guarantors, and things of that nature to their office staff without the need to have them integrate with registration or medical records staff at the hospital. When selecting a patient and looking at the folders as well, you'll notice the navigation is very intuitive. So for patient information exchange to be effective, you should limit the amount of time that's necessary for training. A function, a flow that is inherent with their daily office functions and their things they're familiar with. So in this particular flow, you're looking at it from a folder perspective. There's no question about where they're going to find demographics information and where they're going to find provider information. It's all clearly delineated on the screen. The importance of providing the patient information in an effective way is to allow them to use as few clicks and as few navigation pieces as possible, preferably working from the flow that they're going to have for providers, which is typically looking at a patient on a daily basis. They're making rounds. They're looking at what has happened on that patient since they saw them last, giving them a view that pulls all of those various legacy systems into one view, simplifies, streamlines that process. A snapshot giving them the ability to view bedside charting, vital signs, perhaps the intake and the output, lab values, in the chart order that they're familiar with. You'll notice that any abnormal values are actually indicated in red. The ability to look at the graphing for those lab values or any discrete value, seeing if something is in or out of range visually, being able to trend over time. Continuing down, getting the opportunity to see radiology results, again, all from the same page, seeing that there are radiology results and there's some that have PACS images available. The ability to navigate to that PACS system from within this one system again, eliminating another ID and another login, because all that is done on the back end of the patient information exchange. Physicians actually can now go in and see the images and actually see them prior to when the radiologist has interpreted them. So if you have an orthopedist that needs to look at an X-ray and doesn't want to wait for the radiologist because he wants to look at that now, he has that capability the minute that image is completed to go and view that through this patient information exchange. The ability to see the text result once it is completed from the same location that they were looking at that image. Continuing, they've looked at the vital signs, they've seen the INO, they've seen all the lab values, and they looked at the radiology results. And maybe they've decided now that they would like to place an order, perhaps order an ultrasound of the abdomen. The list of outstanding orders helps them know that there are orders already placed on that patient that haven't been completed. Perhaps it was by another provider, another consultant. Seeing that that has already taken place eliminates the need to place an order yet again for doing the test twice, duplicate orders. And then continuing, you see what active medications the patient is on. So from this one screen, you're getting information from multiple systems into one solitary view without the need to log into those various systems. Patient information exchange provides a way to facilitate improving patient care, reducing costs because it is a short implementation cycle, providing physician satisfaction, not allowing the technology to get in the way of the workflow of the providers, having them on board, having them behind you and supporting the decisions you've made because what they are able to do meets their clinical needs. Then when you do go to change new systems and put a new PAC system in and you put a new lab system in, it all looks and functions exactly the same to those providers. Hopefully this is providing enough information to introduce you to how patient information exchange can work in your environment and help improve the satisfaction of your physicians, to help minimize some of the cost of keeping the physician satisfied with that workflow and help improve patient care.